All right, good afternoon, everyone. Thank you for the previous session, and thank you for your attention on that. I know it's a very interesting topic, isn't it? We could go on and on about this weight loss journey. I'm sure lots of questions came through, but we'll try and answer them online at another date, and I'm sure people will be writing in. So I personally asked to chair this session. Yes, please. I'll just close the slide. And I personally asked to chair this session because Datuk Ganesh Bhaskaran is sharing his own personal insight into what it means when you're a doctor and you become the patient. And that is a very, very difficult thing to be when you know exactly what's going on, what's happening to you, what you're supposed to expect, what's not happening, what your expectations are, etc. So I'd like to introduce this wonderful person to have a chat. I think, Dato' Ji, I don't think you need slides, right? You're just going to talk off the cuff. Fantastic. But I'm going to be more strict than the other chairperson. I've got to stop you by 4 o'clock because I've got to run over for the other session. Okay, peace. So, for those of you who don't know Datuk Bhaskaran, I will say he needs no introduction because you've seen him quite extensively over these past 3 days. Apart from being our wonderful organizing chairperson, he's also the Vice President of Malaysian Healthy Aging Society, so we're very lucky to have him. And you've had quite the year, but you've also had a very illustrious life. He's a fellow physician. He has run many, many clinics, a string of GP clinics all over Johor, under the now called Qualitas Group. His wide experience in general practice. He's also the life member of MMA and was, until recently, their president of MMA. And he's, of course, got a corporate background as well. He's got his own company called NGB Consultants. And, of course, his years of experience in the day-to-day management has actually, and all your, I won't say corporate, I won't say political, but maybe all of that connections has actually gathered us as many sponsors as we've had. Yes, so I won't say anything more apart from that. Oh, if you've heard of Home GP, this man put the idea of Home GP service going on in the connections that we know today. So we'll have to thank him, and I look forward to your talk, Datuk. Would you like to come to the podium, or would you like to, or sit just where you are, because it's not a live audience.
Yeah, no problem. Yeah. I must be comfortable. I must do dancing a bit.
Yeah. So what we'll do?
Without the dancing, I'll be there.
Yep.
I can stand along.
Yeah.
Okay. I want to practice my stepping also.
Okay. Good for you.
Good evening, friends. Chairperson, the very caring Prof. Sharul, geriatric professor. The topic I chose was because what happens when a doctor becomes a patient? The simple answer, I become a better doctor. Only when you become a patient and you go through the ligaments or whatever you call it, you become a better person. I was taught this in my medical college in India by my very famous professor, who was a very good surgeon. He said every doctor must go through 3 things. One is proctoscopy. You know proctoscopy those days? Second, he said, you must go through, that was the best thing, you have to have an operation under your bottom up. Because then, when you want to pass motion, you have a fissurectomy. If you have a fissure, and in the next day, first thing after operating, you say, don't think about passing motion. The next day, whole day, you'll be thinking about passing motion. And the first part, it comes out, oh my God, you sweat. I've gone through that. Third is, he said, my other professor told me circumcision. So I underwent circumcision in India. And the moment my professor's dirty fella is a bad man, he said, don't dream of any sex. So you have to sit on thinking, I don't want to think of sex. I don't want to think of sex. You know what happens to the men. So these are the 3 experiences I went through. So I always felt I'm more compassionate compared to many of my friends. My life has always been working for people. I became a doctor not of choice. I would have made a better lawyer because I can lie very well, like an ex-politician. I worked under Swami Velu, so once you work under Swami Velu, you know how to tell people. Total. Out of 99% or 100%, only one will be the truth. Anyway, I gained a lot of experience from him during my days in politics. I came in very early. I come from a very illustrious family. My father was very involved in politics. We were the richest person, Indians in South, but unfortunately, when you go into politics and you're a good politician, clean politician and honest politician, you don't survive. In this country especially. So when I came back, I was always involved in public life. School days, when I was in India, I was a Foreign Student Association president. I came back, I went into Tamil Association in Johor Bahru. Then I went on to temple building. Then I went on to the club. Then I went to MMA. So, name it, I'm there already. I've done social work. I've done political work. But I wanted to be a good politician because I had a big practice going. In the time I joined politics, I asked my great leader, should I come into politics? So the leader said, you come. It'll be good. We need people like you. So I got carried away. And I got involved and I did very well. Not as a doctor, as a human being. I served and I made name not as a Bhaskaran, Dr. Bhaskaran. Those days all doctor mean very big during my time. But I went and made it on hard work and my own selfless service. So this is what I believe must be the reason that all of us have to live for. When I got into the hospital last year, I was a COVID president. They called me MMA. When I was MMA president, COVID came about, and I was the one who was making all the statement in the press. So COVID got frightened of me. But that guy never kept quiet. He sent his cousin, our bacteria, MRSA, to send to me, take care of this fellow. He's talking too much about COVID. So when I got the attack, first day it was my backache. I went to my surgeon, my very good surgeon in one of the hospitals. He looked at it, he said, I think you're getting back your cervical spondylosis. He gave me some medication and sent me back. Next day the pain was severe. I went back to him, he looked at it and said, no, I think there's something wrong. You better stay in my hospital. That's very limited hospital. Then after that, I stayed there. That night, morning at 3 o'clock, suddenly the call came and my oxygen level was 50% down. So I was rushed to Glen Eagles, the best hospital, especially when it comes to pain. So I was kept there because he was working there. For 5 days, I think I was gone because my kidney, my lungs failed, my kidney failed, my liver failed, everything failed. So the 4 days experience, many people don't know why I'm saying you have to be a patient to become a good doctor is, I was actually the first 4 days, they were saying me, the doctors had said is going down. So all my family was told. And nobody told me anything to my mother. My mother is still alive, never told anything. But unfortunately, my eldest being a doctor, she's in Perth. So she was monitoring. My wife was sending some signals to her, monitoring and all that. She 1 day, 2 day, 3rd day, 4th day, she called my mother, my wife and said, Amma, Appa is dying. So please inform all the relatives. So my wife, she didn't inform, my son informed, not my son, my daughter, the eldest daughter was a medical doctor. Medical doctors are the most panicky. They went and told, so everybody what came to know. Then they have to have group prayers and all that. So within 9 days, I have insurance. Luckily, I went into hospital with insurance. I'm covered for 1 million, but for every disease, only 150,000. Within 9 days, it was 120,000. So my wife was calculating how to get this fellow out without paying more bills. And I have a good insurance agent. Mind you, when you buy insurance, you also must have a good agent. My agent was so good. As usual, it was a Chinese friend of mine, long-term friend. Within 4 days, he got the bill settled. Then 4th day, I was recovering on 5th day. How I knew later, because when I entered, I was completely delirious. I was accusing the doctors there, all the physicians, all taking care of me. They are crooks. I was shouting, it's in crooks. They're trying to steal my property. I don't know which property they were trying to steal. So everybody panicked, say, what this guy is doing? So I said, call the IGP. I got his number. My wife knows the number. Call him. I want him to come here. Then of all the person, I say, please call Moideen, because he's also my friend. Not enough Moideen. I say, call Saravanan, the best of the MCHA leaders now. So I say, all of them are panicking. They're laughing. I think all of them are sitting. My son does better mimicry than me. After all these episodes, he has learned how to speak and become a standalone comedian. Then, luckily, I had good friends. They all looked at it and see my bill was running up. So finally, they managed to go to UMP, University of Malaysia Medical Center. Some or other, Prof. Sharul, and then Nathan and Prof. Raghu, all these got together and they made some arrangement. God willing, I got a place there after 10 days. I was shifted there, and I think they gave me excellent care. I mean, I'm not trying to praise her because of that. I always remember gratitude for me in life. If one person does one little small help, I'll never forget the person in my life. Subbarao is here. He's from Consumer Association of Penang. He knows me very well. Whenever somebody calls, I do my work. So I think God saved me, brought them to the good hands of Sharul and Thao Maupin. And then, another Prof. Tan was there. So the nurses were good. Everybody was good. I mean, complaint is always complaint. Nurses are so bogged down with so much work, you can't expect them to attend to you 24 hours. Then I had 2 caregivers, the wonderful caregivers. The first one walked in. I don't know whether she was a he or she. So then, but fantastic care. But one thing about it, my family is sending all kind of cooked foods and all. She ate nicely and put on 10 kilos before she left me. Then another person came and took care. But I'm telling you why. She said about Home GP, yes. I was responsible for creating Home GP, which is one of the largest caregiving company in the country right now, online. And so I stayed there for another 20 days. Sharul felt that, after this Bhaskaran, you better go to the region hospital. You'll have the cross infection. I landed up in region hospital, which is another, as long as you have money, you must go there. So I went there, landed. She recommended, but good, very good people, very good physiotherapists and all that. Yeah, I came out. But that experience I was always in a, you may not believe me, I was always very active in sports also. Badminton, I was very good. But I tore both my tendons 10 years ago, 15 years ago, so I stopped. But I dance. I love dancing. From the young age of 15, I was stepping on ladies' leg and all that time. I learned to become a good dancer. So even now I dance for 45 minutes. I was a region for 10 days. I got out. I did 3 times a week exercise. Then went to twice. Then went to single. Then October I stopped. Then I realized because bill was also going up. So I went and started dancing. I dance 45 minutes every day. I can turn on and dance. And this conference, we are putting it to Facebook, we are putting it to all these things, no response. One day I did TikTok dance. Next day, 300 people became at my admirers. I got a club now under my name, under TikTok. So now, this is the only thing I have gone through. So you must know that all this experience does not come to you by giving advice to patients. We can give, most doctors are compassionate. I'm sure all of us are taught to become compassionate, ethical and all that. But I always believe, that's now I attended 2 conferences before coming here. One was about keto diet. One man monopolized the whole session, so I'm not going to talk about it. But earlier, my wife and other people were talking about legality. And I'm one person who believes that the right to live must be given to me. It cannot be decided. My doctors will have to save me, but they cannot, because the family goes through severe, the trauma my wife went through, the trauma my children went through, my friends went through. Nobody knew because I'm a guy with the phone all the time. I answer calls within 1 minute. But suddenly I realized the calls, nobody heard me talking. They decided what happened to Bhaskaran. After 1.5 months or 2 months, I put my own photo and say I'm safe. Then everybody started calling me Dr. Bhaskaran. My wife took the phone away. So this is, I believe, is something all of us must be compassionate about. And when I left, I told Prof. Nathan, and I said, I'm not interested in working anymore. 45 years of my public life is enough. But then they had to convince me, as usual. They came and said, no, doctor, you'll be mentally affected, because I also got mental problem. There's nothing wrong. I got a psychiatrist friend of mine, Philip George. So he told me, Dr. Bhaskaran, you shouldn't be relaxed. You must do some work, then your mind will work. But I'm a bad habit is when I start working, I become a tough master. So when they said, you become president, I said, no way I'll become president. Then I said, let Prof. Sharul propose her to become president. I'm so happy, such a wonderful lady, so smiley. She can control the crowd. Men, she tells the men will have to ban. I tell somebody, they get angry. So she's the president. I'm the vice president. First time in my life, I'm working with 3 powerful ladies. Secretary Sangeeta Kaur, what a wonderful job. She took care of the secretariat. And finally, the most strongest person is my wife, Renuka Devi, who is now the treasurer. She was earlier the secretary, now they transferred her to what they call treasury. So with all that, I believe we all have to be compassionate. This healthy aging conference, when I started going, I told all of them, I said, if this conference doesn't bring in 1,000 participants, then it's not a conference that I like to do. Earlier we wanted to bring physical participants a lot, but today, as I said, we crossed 1,108, which is quite an achievement during this period of time. And I hope all of you enjoyed it. My own thinking is, we have to be compassionate, we have to be caring, And above all, everybody wants to make money, but that should not be the criteria in our mind. There are many times doctors can play a better role than what they're doing sitting down in the clinic and advising. And in this point, I tried very hard. I have 4,000 doctors' numbers. If anyone steals my phone, you're lucky, you can sell it for data. 5,000 numbers. But unfortunately, the number of calls we made is more so the senior doctors who thought that they needed help. The younger doctors think, no, I think it's okay. When the time comes, I will learn about it. But what we were telling them is, learn it so that you can start doing it from now. Like the medical students, if they start learning about this healthy aging and caring, I think they will become better human beings and better doctors in the future. Thank you, Prof. I didn't finish already. My time is over, isn't it?
Can I invite any of the audience to ask Dr. Bhaskaran any questions, any advice, etc.?
Ada online, ada jawapan sini ya. Tengok kalau dia tahu saya marah, dia orang tak tanya online. Nothing ya. Over. Okay.
Okay.
She would know what you get this.
So perhaps I could ask Dr. Bhaskaran a question.
Yeah.
I mean, how?
Please sit down. I don't like to see a lady standing when I'm sitting when I'm standing. Opposite, I said, I don't like to see a lady standing when I'm standing. You must be sitting. Okay.
Thank you. How did you feel? I mean, this is a rare insight. Someone who's one of us, who's a doctor, who's a healthcare professional. He underwent quite a severe acute illness, and he was in ICU for some time. What was going through your mind as a doctor and watching all these things happen to you?
Well, as I said, Prof, you won't believe me, sometimes this real life experience, sometimes you read in many of the Reader Judge's stories, you say, the man is dying, he sees his life, soul going up and coming back again. You have read many of these stories. I also had the same experience. I mean, it's shocking, because I now realize the first 4 days when they said I'm going down and down and down, every day I was on a supersonic jet going up, then coming back and crashing. Suddenly crash, I opened my eyes, I'm in the room. Every day it happened for 4 days. But the day I was recovering on 5th day, the thing disappeared. So if you ask me what happened, Dr. Bhaskaran, I can't answer.
You went through a delirium. That fluctuating level of going up in the supersonic jet and down and going up and down.
But then when I recovered, they said, Dr. Bhaskaran, first 4 days we gave up on you. So the first 4 days only this experience. On the 5th day when I was recovering, I think I never had this dream or whatever that came to me. So I don't know. This is all part and parcel. When you go through as a patient, you come out. And I think I learned very easily that, I'm a compassionate person from those days. I'm a bit of a angry young man I was. I'm a bit of a tempered person. But when it comes to helping people, it has always been my blood. Since the time I was in school, since I was in college, since I was in public life, I never hesitate. Even now, though I'm not the president of MMA, I get a lot of calls of people, please help me, please help me. I try my heart. I try my best. If I can help, I help. If I cannot, I don't. So I think that was part of me before I went. So I realize now that there are people who go through a lot of things in their life which they are not able to express, especially as doctors, because we are supposed to be the pillars of strength to show others that we are very strong. But I'm a human being myself. So I can't, I have my own feelings and everything. And I realize how much my family and my friends meant to me. I can tell you, none of us can live without friendship. None of us have to have, at least in Tamil they say, 4 பேர் இருக்கணும். That means 4 person must be always with you, finally to carry you. That's what they meant those days. But I'm saying you must have a caring family, especially a loving wife. You must have a very good children who know about you, what you sacrifice. You must have very good doctors and carers like what Sharul and the others be. And finally, the friendship. We need the good friends to be with us because they are the encouragement that they give you at the last minute to come out of it.
So what Dr. Bhaskaran went through was something that we all need to try and cultivate throughout the whole course of our lifetime, because you never know when you fall sick what you actually need. So that support system of coming together, he's lucky because he cultivated quite a number of good friends, and he's knowledgeable, he's a doctor, he could garner some support. But I have got one question for you, Dato. what motivated you to get back on your feet? Because that was you were down in bed for a long time. And it was so difficult for you. I remember we had to prop you up to stand.
I know.
What got you back on your feet again?
No, actually, honestly, Prof, now that you're asking me, I like to speak a little truth, at least now. I actually wanted to go off. I said, I've done my part, I've done my job, I've got good children, all educated, and my wife is still around working as a lawyer, and I just felt that I should go off rather than be a burden to the family another couple of years. I don't want to stay till 96 years old. Who wants to be there till 96? They all say, if you're healthy, you be. It's going to cost them heavy if to my family. My children are going to be affected. You ask me, Dr. Bhaskaran, how have you done in your life? I'm telling you, financially, I was robbed of all my wealth and my practical practice during the first 14 years. But after that, I recovered, friends again. I became really richer for 7 years. But it's the sustaining power. When you are a giver, you always like to give. You don't like to receive much. So I'm not complaining. God willing, I've been done well. But what she said is the motivation came into me only. I said, if I can come out of this, I'll be able to do a bit more for my people. When I say people, I'm talking about everybody. But the worst is about my community. They're totally... That's why when he was talking about diet, I was a AB set man just now. AB. I learned how to diet myself. I broke down 70 pounds. Nobody taught me. We go to the physician, will say, take this Duramin. So another doctor, Baigundan, who kept here today, he became my consultant. He was 265 pounds, I was 230 pounds. So the motivation must come within you. And someone motivates you, then you pick up the motivation. So I felt what she's asking is, I felt if I still live a little longer. I'm not asking honestly, I believe in God. I say I don't want to live too long. I believe you must be always healthy, like what they're saying, as long as you can take care of yourself. You don't need a person coming, even your wife or children holding you and taking you. That's a day I'm praying to God. I don't want anything else. Send me peacefully up there. So this is the motivation in my heart that when I come back, I will be a little bit of more help for a few more people that I can help. That's all.
Speaking of motivation, we've got a question from the online audience. Jennifer, thank you for your question. As a senior healthcare physician, how do you motivate or encourage the younger generation to be more passionate in their service?
That's a good question. Thank you so much. I think I was waiting for some young doctors to answer a question me, but I think basically we all are born as good human beings. You are lucky enough. Some people are born lucky, some are little lucky, some are more lucky than others. Like say all men are equal, some are more equal than the others. You have become a doctor. Why did God choose you to become a doctor? The reason is you are being given a different kind of a living, a different kind of a life for you to serve. The first point is serving. And and I believe when I was in general hospital for 4 years during my first term, I believe that was the best experience I've ever had, because there is no talk of money, The moment you go to a patient, you hold the patient, you say, Pachi, Apagaba, you talk to a Chinese person, how you are, and you just give them a little compassion. Touching them itself, they will feel so happy. So that compassion thing must be in your heart as a doctor. If you are not compassionate, you will never be ever a good doctor. You must treat every patient, it is your uncle, your auntie, your mother or grandmother. This is one thing I learned during my hospital, because after that when I became a GP, generally GP or private things and all that, it's not that we are out there to make money. We want a comfortable living. You want to send children, you got 3 children, all must be professional. Some people are so good at that, they put all 5 children in doctors. Now we have 75,000 doctors. So that's the reason why you must always look at first doing what right, not for yourself, for the patients that you're looking after. Then treating them as a family member gives you a little bit of. So when you become a GP or when you become a private specialist, you will still have the compassion in your heart. That's my advice to the young doctor.
Thank you very much. Before we close the question, let me invite any further questions from the floor.
I think you should come out a book, Doctor.
No, I'm doing my book, but no time already. I'm doing 3 generations of roots. How my grandfather came here as an immigrant, how he toiled in the estate, and how he made himself into a provision shop. My father is another super intelligent, better than me. No education, he became the biggest, richest man in South, in India, among Indians, not the Chinese, not the Koch brothers. But just to tell you, Koch brothers used to buy sugar from us. And later they became the sugar king and we became the rubber king. Anyway, after that, I have also done it. But I think sometimes it's not just telling a story. I'm writing the book. Basically, I want people to realize how different stages of our life has got in this country. And this is my country. I don't know any other country. Even you say pendatang, never mind. I'm pendatang means I'm not going to be worried because I know I've done my service. How many people have done service for the country? We all have done service. You know, if the Malays were fantastic farmers, Chinese were good tin miners, Indians were good rubber tappers, all this has paid into the country. So I'm very compassionate about my own country. You can tell me to go anywhere, I can go. But next step is no more back to India. I'm going up. Thank you so much.
Thank you, Datuk. I'd like to thank Datuk for sharing his experience.
Thank you, ma'am.
And everything and all that he's gone through. So we wish him every success in his healthy aging pursuit. And as for the rest of you, just to summarize, as healthcare providers, as physicians ourselves, as allied health professionals, we have a mission when we set out to do our work, etc., and in helping others fulfill, whatever goals that they have with regards to their healthcare. But I think there's one thing that we must also bear in mind, and drawing from all the various lessons that we've had from the various talks. This morning there was about the concept of ikigai, etc. It's about having some sense of reality about your own self, to take care of yourself, to take the time, because only then we'll be able to sustain our health, our goals, our needs, and to meet the demands of our job, our life, our stresses. So there's always a lot of room for me, for yourself, and I think a lot of healthcare professionals throughout these 2 years during the pandemic went through a very, very tough time, especially our junior doctors, our nurses, our allied health professionals, emergency physicians, etc. And there was no time to breathe. Underneath all that PPE, there was no time to eat, sometimes no time to sleep, etc. So I think this message goes out to all of you who have gone through this and are still going through this, but have had time to listen in today for our talks, that Datuk Bhaskaran brings back information of how he became the patient. And I know some of you may have gotten COVID. In fact, I just recovered from COVID, and a couple of us here too. And that gives us time to take stock. When you're strapped in bed, unable to move, unwell, etc., it gives you time to sort of sit back, take stock, think about what actually is important in life. And that is actually your health, which is on borrowed time, your friends, your family, your environment, and do take care and be good to yourself as you are serving others. Thank you so much for your time, and I'd like to draw the session to a close. Thank you all.